Hello, I'm Dr. Merrill Winston, the Director of Program Development for PCMA, and today we're going to talk about 7 factors that can affect the safety of crisis intervention procedures. And whether or not you're using the PCM system, these are still important factors to consider. The first one is design of the procedure. The design of the procedures can be very important because it can have an impact on the safety of the individual that you're using the procedures with. Does the design does it ignore body mechanics and natural body positioning? Does the procedure put the individual in an awkward position? Or does your procedures put the individual in a natural position, the way their body normally moves? The design of the procedures are also important in that the procedures have to be robust. That is, the design has to be such that it's not easy for staff to make critical errors in the procedure that could result in injuries. And if the design of the procedure is such that staff can repeat it numerous times and small errors don't really affect your incident rate, then we refer to the procedure as being a robust procedure in design. That is, the people can do it reliably and consistently with very little variation. So that's one aspect of safety when it comes to restraint procedures. The second aspect of safety is training. And that involves the number of hours of staff training, whether or not the training is competency-based, the criteria for having staff reach competency. So how the staff are trained is critical. If it's attendance-based and the staff are simply there and they go through the course and they sit for a number of hours and they do a few things that you do, that's not necessarily competency-based. So there has to be some sort of an exam and some sort of a criteria for passing. The criteria in our system, for example, is an 80% pass rate. So training can also make a critical difference in the development of these skills. The training also has to be of sufficient length. It's inconceivable that staff can learn complex physical procedures, enough of them to be useful in a 4-hour training. Our minimum training is 14 hours in our system, and other trainings are 18 or 22 hours in our system. So the length of training has to be sufficient for staff to be able to gain the skills that they need. Another issue in safety of procedures is skill retention. So after your staff have been trained, they still have to retain the skills that they've learned. Otherwise, it's not going to do them much good. And if staff tend to use the skills frequently, all things being equal, they tend to retain them better. But if the physical skills you're teaching your staff are used only infrequently, all the more reason to give them some brush-ups now and then and some pointers on what they should be doing and some quick review. At the very minimum, staff need to be recertified annually. However, we recommend that if your staff don't use the procedures very frequently, that you check them out more frequently than annually. That is, in our system, in the PCM system, people have to be recertified a minimum of annually, but you may want to check out their skills even monthly, depending on how frequently they're using them. So skill retention is critical. Some individuals, after a year's time, they still do the procedures flawlessly. Other individuals may not. And so it's incumbent upon your organization to ensure that your staff skills are always what they should be. The fourth area of physical safety, of physical procedures, is utilization criteria. And that simply means, when are staff authorized to use the procedures? If you don't have clear utilization criteria, both including when to start procedures and when to stop procedures, you can run into a lot of problems. The biggest one is that staff will tend to overuse the procedures. So if you're using a definition for the initiation of emergency procedures in physical restraint, such as danger to self or others, then staff may have widely varying ideas of what danger is. In the PCM system, we use the criteria of, we call it CASH, which is continuous aggression, self-injury, or continuous high-magnitude disruption. At least when we use our definition, staff understand that the behaviors have to be continuous and that we don't do crisis intervention for one-time behavior that stops. So utilization criteria is very important, both regarding when to initiate restraint and, just as importantly, when to terminate restraint. In the PCM system, we begin to terminate restraint after 3 seconds of no resistance from the individual. And this is very important. Some systems use utilization criteria like 5 minutes of calm. Well, 5 minutes can be, relatively speaking, an eternity during a crisis. And that's why we opt for 3 seconds instead. So utilization criteria is another critically important variable. The fifth variable that makes systems more safe or less safe is oversight, particularly clinical oversight, that is management of your staff. Even well-intentioned staff that are poorly managed with little oversight can begin using procedures for the wrong reasons, they can do procedures the wrong way, and a variety of other problems can arise for staff who are not properly supervised. The more severe the behavior problems that you're encountering in your organization, the better staff need to be supervised. So oversight is absolutely critical in any system of crisis management for it to be as safe as possible. The sixth variable is medical evaluation. All individuals should be evaluated by a physician before even initiating crisis intervention procedures. There could be a number of potential medical contraindications for any one individual for them struggling against resistance, be it in a prone or a supine position, or even in a standing position, or even doing transportation procedures. Individuals with pre-existing medical conditions should be checked out thoroughly and be given physician approval before beginning any procedures. That's our recommendation. The last and seventh factor that can impact the safety of physical procedures is the existence of treatment programs. That is, if there is not some kind of behavioral program in place to address behavior problems, more often than not there's going to be an overutilization of crisis management procedures. And to avoid this, there should be good existing treatment programs in place. If your facility is simply trying to use crisis intervention as a means of containing someone and there's no other treatment going on, there's a good chance you're going to overutilize these procedures and they'll be used for a longer period of time than is necessary. So existing treatment programs is absolutely critical. So those are the 7 factors that we believe make crisis management more or less effective.